When an infant is unresponsive and not breathing, or only gasping, it is critical to begin CPR right away. As with adults and children, CPR for an infant consists of 30 chest compressions, followed by 2 breaths. In this video, you'll first learn how to give effective chest compressions and breaths to an infant. Then you'll learn how to put these skills together to give CPR cycles. The sequence of steps for giving chest compressions to an infant is the same as for adults and children, but the technique is different because of the infant's smaller size. First, ensure that the infant is on their back, on a firm, flat surface, such as the ground or a stable tabletop. If they're in a stroller or on a soft surface, carefully move them to a firm, flat surface. If they're in a crib with padding, but no soft mattress, you can perform CPR there. But if there's a thick, soft mattress, it is better to move the infant to a hard surface or remove the mattress. To give chest compressions to an infant as a single responder, use the encircling thumbs technique. Using this technique makes it easier to compress the infant's chest, which results in less fatigue. Stand or kneel to the side of the infant, with your hips at a slight angle. Place both thumbs side by side on the center of the infant's chest, just below the nipple line. Then use the other fingers to encircle the infant's chest toward the back, providing support. You are now in the correct position to give compressions. When giving compressions, push hard and fast. You will use both thumbs at the same time to press down on the infant's chest. The compression rate of 100 to 120 per minute is the same as for an adult or child. The depth of compression, however, is less due to the infant's smaller size. For an infant, compress the chest about 1.5 inches. After each compression, let the chest return to its normal position. Remember, compressing the chest and allowing it to fully return to its normal position moves blood carrying oxygen to the brain and other vital organs. Watch as I demonstrate just a few chest compressions using the encircling thumbs technique. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Alternatively, you can use the 2-finger technique to give chest compressions to an infant. Using your hand closest to the infant's feet, place 2 fingers in the center of the chest, just below the nipple line. You can use your index and middle fingers, or your middle and 4th fingers to give compressions. Fingers that are more similar in length tend to make compressions easier to perform. Place your other hand on the infant's forehead. This will help keep the airway open while you give compressions. When using the 2-finger technique, be sure you're able to compress the chest about 1.5 inches. Watch as I demonstrate just a few chest compressions using the 2-finger technique. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Giving breaths supplies oxygen to an infant who is not breathing. Breaths in combination with chest compressions increase an infant's chance of survival and minimizes brain injury. The sequence and technique for giving breaths to an infant is similar to giving breaths to an adult or child, with a few differences. First, when opening the infant's airway, use the head tilt chin lift technique as you would for an adult or child, but open their airway to a neutral position. Do not tilt their head back too far. Second, similar to an adult or child, you should use a CPR breathing barrier if one is available. When you're using a face shield, make a complete seal with your mouth over the infant's nose and mouth. When using a pocket mask, you need to use an appropriately sized mask in order to make a good seal. Some pocket masks are one-size-fits-all for adults, children, and infants. In this case, follow the manufacturer's recommendation for use. For example, according to the manufacturer, you may rotate the mask so that the narrow end fits over the infant's chin. In other instances, separate pocket masks are available for use with infants. So, to review, Use an appropriately sized breathing barrier. Open the airway to a neutral position. Take a normal breath. Make a complete seal with your mouth over the infant's nose and mouth if you're using a face shield, or over the valve if you're using a pocket mask. Give 2 breaths while maintaining an open airway in the neutral position. Each breath should last about 1 second and make the chest begin to rise. And finally, pause between the breaths to allow the infant's chest to fall and the air to exit. Watch while I demonstrate. Remember, if the chest does not begin to rise on the first breath, reopen the airway and give a second breath. If the chest does not begin to rise after reopening the airway and giving a second breath, an object might be blocking the airway. That is, the unresponsive infant may be in cardiac arrest due to choking. You will learn about caring for an unresponsive infant who is choking in the choking module. Now it is time to put the skills you have just learned, giving chest compressions and giving breaths, together in order to give cycles of CPR for an infant. As with an adult or child, each CPR cycle consists of 30 chest compressions followed by 2 breaths. Remember, it is important to begin each CPR cycle with chest compressions. However, if drowning is the suspected cause of cardiac arrest, deliver 2 initial breaths before starting CPR cycles. Also, make sure you smoothly transition between compressions and breaths. Interruptions and compressions to give breaths should be as short as possible, taking less than 10 seconds. Okay, now watch as I put chest compressions and breaths together to perform 2 cycles of CPR. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. You should continue to give CPR cycles until you notice an obvious sign of life, like breathing, an AED is ready, another trained responder is available to take over compressions, EMS personnel arrive and begin their care of the infant. You are alone and too tired to continue, or the scene becomes unsafe.